Honorable Chair of this session, respected panelists and all participants, greetings from Bangladesh. It is my pleasure to present the research study in this prestigious conference. Now I am going to talk on the pattern of refractive status and associated ocular diseases among the children in the southern region of Bangladesh. We know that Bangladesh is a small densely populated country in South Asia. Total population is about 165 million. In our country, total qualified physicians are about 54,000. Total ophthalmologists account 1,200. The correction of refractive errors is challenging due to the lack of resources. Refractive error can be divided into myopia, hyperopia, and astigmatism. Again, astigmatism is classified into myopic astigmatism, mixed astigmatism, and hyperopic astigmatism. Refractive error is the most common cause of visual impairment and second most common cause of an avoidable morbidities in the world. Amblyopia may develop if it is untreated. Timely management can help to prevent refractive error-related visual impairment. Now, objectives of this study. We attempt to assess the overall pattern of the refractive status of the children, to assess the rate of different types of refractive errors, to evaluate the rate of amblyopia, and to assess the associated ocular conditions like strabismus, ocular trauma, eyelid disease, lacrimal drainage system disease, and ocular surface disorders. Now, point for justification of this study, we know that uncorrected refractive error may cause permanent visual impairment. Early management can help the improvement of child visual potential, which also help in academic development of the children. Our hospital is a service-based tertiary eye hospital, and people are getting eye care service from 21 districts of southern region of Bangladesh. It is essential to build up the awareness which can help in evaluating the visual status and also preventing the visual impairment of the children. This prospective cross-sectional study was carried out in a tertiary eye hospital of Bangladesh from 1st February 2021 to 30 June 2021. A purposive sample technique was performed according to the selection criteria. The study was included all the children from 6 years to 12 years who were attending in the outpatient department of this hospital. This study excluded all patients who were attended at the emergency department of the hospital, severely ill children, non-cooperative children, other causes of visual loss, presence of active infection, phthisis bulbi, and intraocular tumor. Variables include demographic profile like age and gender, profile of the visual status, refractive status, strabismus, and amblyopia. Outcome measures included the mean age of the study subjects, the rate of refractive errors, the frequency of the amblyopia, and associated ocular morbidities. Prior to clinical evaluation, an informed written consent form was taken from the attendant guardian of the children. The ethical consideration was maintained according to the Declaration of the Helsinki. A pre-designed data format was maintained by the researcher team and data was analyzed by SPSS software version 17. This is the flow chart of the study. Here we are showing few photographs during the examination of the children and also counseling of the guardian. This is the consent form and this is the data collection format. Now results. At first, demographic profile. A total of 228 children from 6 years to 12 years of age are evaluated in this study. Among them, boys were 62% and girls were about 38%. Most of them were in the 11 years to 12 years of age group. The mean age of the study subjects was 9.84 years. The minimum age was 6 years and the maximum age was 12 years. The median age was 10 years. We also evaluated the distribution of the uncorrected visual acuity and best corrected visual acuity. The visual acuity was improved after the correction of the refractive errors in both eyes. The uncorrected visual acuity was 6/12 or less in about 50% of both eyes. That was reduced to 8 to 10% after correcting the refractive errors. Of total 228 children, 38 children was presented with emetropia, and rest of the 190 children were associated with emetropia or refractive error, that is 83.3%. Among the 190 children with refractive error, myopia was the highest occurrence, that is 47.9%, followed by astigmatism 41% and hyperopia 11%. Among the children who were presented with refractive errors, boys were 113 and girls were 77. There were no statistically significant differences among the different types of refractive errors in the boys and girls. Astigmatism was found in 78 children. Myopic astigmatism was more preponderant than mixed astigmatism and hyperopic astigmatism. Strabismus was found in 50 study subjects. Among them, 90% children showed alternate esotropia and 10% children were associated with alternate exotropia. We found 15 children who were presented amblyopia. Among them, unilateral amblyopia was found in 5 children and bilateral amblyopia was observed in 10 children. That was 66.7%. All the study subjects, 38 children, were presented with different pattern of ocular trauma. Subconjunctival hemorrhage was found in 6.6% of the children. Aneurysm was found in 1.7% of the children. Corneal abrasion was noted in 3.5% of the study subjects. Ocular surface point body was extracted from 2.6% of the children. Ruptured globe was diagnosed in 1.04% of the study subjects, and corneal trauma was evaluated in only 2 children. We also evaluated the associated ocular disease with refractive errors of the children. 68 children presented with associated ocular disease, that is 29.8% of all children. Among the 68 children, ocular surface disease was noted in 32 cases. Eyelid disorders were found in 24 children. Lacrimal drainage system disorders were noted in 8 children, and cataract was diagnosed in 4 children. Refractive error is commonly encountered visual problem in children and may be associated with other ocular problems. The distribution of refractive status changes gradually as age increases. The children were divided into 4 groups according to their refractive status: emetropia, myopia, hypermetropia, and astigmatism. Refractive error may be associated with strabismus and amblyopia. Uncorrected refractive errors are attributing a major percentage in visual impairment, which can cause a significant ocular morbidity in the children. Several studies reported a very high proportion of emetropia. The prevalence of myopia in school-going children is much higher than other refractive errors. Astigmatism and hypermetropia is also observed in significant numbers of children. Increasing the occurrences of myopia and astigmatism is still unclear, but it may increase with prolonged near work activities or reduced outdoor activities because of a load of study. A trend with children spending a significant amount of time engaged in using smartphones, tab, computer, or laptop for game fascination, and also reducing outdoor games and movements. Our study involved 228 children. The mean age is 9.84 years. Refractive error was observed in 83.3% of the children. The most common refractive error is myopia. Visual acuity improved significantly after the correction of emetropia. Now, conclusion. Emetropia is common in school-going children. Myopia is the most common refractive error than astigmatism and hyperopia. Ophthalmic assessment is mandatory 6 monthly for proper assessment and management of the refractive errors and associated ocular disease. Cycloplegic refraction is essential to assess the actual refractive errors of the children. Early detection and timely management can help to reduce the amblyopia. School screening camps can be helpful for the assessment of the visual status. Thank you all.